Up first this evening, $3 billion. This is what it will cost the government to roll out phase 1 of the national COVID-19 vaccination program. The document outlining how the funds will be used was tabled in Parliament today. But with just 16% of the population set to benefit in the first phase of the program, the opposition continues to make a case for more Jamaicans to be immunized.
The Ministry of Health calls it the National COVID-19 Deployment and Vaccination Interim Plan 2021. Health Minister Dr. Christopher Tufton says the foundation is being laid ahead of the April rollout of the immunizations. In addition to the National Vaccine Commission, which will provide technical oversight, a National Coordinating Committee has also been established. The country is expected to receive over 900,000 doses of the vaccine through the COVAX facility. The first batch will be delivered on April 21, the second July 21, and the third December 21. At the end of the first phase of the program, it is hoped that over 400,000 persons, or 16% of the population, will be vaccinated. But for the opposition, this is not good enough.
I think that is unsatisfactory. We must aim significantly higher than that. Jamaica, in my opinion, should do its utmost to source sufficient doses to immunize our population this year at a level that will achieve herd immunity.
We are faced with a very practical scenario, and that is that you can't access what is not available. And that is the real challenge that we face, and I say this respectfully. I mean, it's one thing to say we need to achieve 60%. To get to herd immunity. But if the supplies are just not there, they're just not there.
Select health centers in each parish will be designated vaccination sites. Sites will also be established at the University Hospital of the West Indies, the National Chest Hospital, and the Cornwall Regional Hospital, among others, for frontline workers. The minister says the first phase of the program will cost the government $3 billion. $81 million has been earmarked for a consultancy firm to develop and implement a communication plan, $20 million for vaccination training, $240 million for the hiring of temporary staff, and $37.5 million for overtime and other benefits. Phase 2 of the program will begin in 2022. According to Dr. Tufton, 16% of the population will be targeted.
This phase may see the vaccine becoming a part of routine immunization schedules and procurements will be absorbed into the regular budget for immunization. This will have to be expanded based on demand and availability of funds. So there is still some amount of flexibility which has to be exercised based on what we learn as we go along.
Persons will require 2 doses of the vaccine. The Ministry of Health says mechanisms have been put in place to remind patients about the second doses.